time.
It seems everyone knows someone who has COVID right now, and while protocols have lifted, the virus is still making things a little complicated.
And here to answer all our questions this afternoon, Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. It's great to see you, Dr. T. You know, it seems like, and correct me if I'm wrong, but it seems like COVID is at least resulting in far fewer serious illnesses. Is that what you're seeing on the front lines?
Absolutely. You remember the days when hospitals were filled with COVID patients. That's definitely not the case right now, but it's still out there, probably less than 1% of admissions at South Shore from COVID. But, it's still learning new tricks.
Speaking of that, there's another variant that's on the move. If there's one thing we know about this virus is that we don't know because it keeps changing, but it hasn't become more dangerous. So how are you thinking about COVID risk and exposure right now, doctor?
That's right, Maria. They're calling it the Eris variant. Eris is the Greek goddess of strife and discord. It sounds pretty bad, but I think it's an exaggeration of what this variant is. But it definitely has a competitive advantage. It's causing more transmissions. There is this definite growth advantage, more immune escape. Those aren't good things, but the good news is it doesn't look like it's more severe. But it's going to be a problem with some of the vaccines and protecting against transmission. Again, I think vaccines are going to be important to decrease severe illness, but the virus is one step ahead of us.
Mm-hmm. Well, and to that very point, Dr. T, if we're always a step behind the actual virus, how should we be thinking about COVID vaccines as we move forward? Because we're going to have to live with it, right? I mean, it's going to be here.
That's right. And what we need different strategies. So we need nasal vaccines to take advantage of the mucosal immunity. We need that universal vaccine. See, right now, these spike protein vaccines, it's the spike protein that COVID is really mutating so much of. So we have to find different parts of the virus. The tricky thing is, Ed, is that even when we get infected with the real thing, the natural virus, we still get reinfected. It is hard to come up with a vaccine that's better than what nature has there, but the government is hopefully going to be infusing about $5 billion in research and clinical trials. We have very smart scientists out there. Hopefully we can get even better than what we have now.
Yeah, and it's actually pretty good as we live with it. Dr. T, thank you very much. Great to see you.
Thanks, Doctor. Be well.
See you later.